I have discarded the soiled glove. This one is a new glove. So now we are going to check for pulsation in the umbilical cord. We are just going to palpate, and we don't have to milk it. If we milk it, it's going to cause fetal distress and others. So we are just going to palpate the cord. Yeah, there is no pulse, so we can cut it. So we will use our plastic clamp to clamp it 2 centimeters from the base of the baby. Then we will use the instrument clamp to also clamp it 5 centimeters from the base. So this is the plastic clamp. We are going to clamp it 2 centimeters from the base, and we will use the instrument clamp to also clamp it 5 centimeters from the base. Then we will use our scissors to cut it close to the clamp and not in the midway. So this is it. We are going to cut it close to the plastic clamp. So this is it. You cut it like this. 10 units of oxytocin was given to the woman after the newborn was delivered. So we were waiting for a strong contraction, and now there's a strong contraction. So supposedly it should not be only one person during the delivery, but since it's only me, if we were to, one person will be massaging the uterus, will be applying traction and counter traction to the uterus, so it becomes firm, and so the placenta gets delivered. Then another person too will be helping deliver the placenta, but since it's only me, yeah, so you will be massaging the uterus until the placenta gets delivered. You don't have to force the placenta to come out, or else there will be hemorrhage. So you wait for it to gradually get detached from the uterus. So assume it has been detached. So we will be rolling until the placenta comes out. Yay, the placenta is out. So when the placenta is out, you have to check whether everything is intact or some part is left in. You have to count the cotyledons, and you have to check for the color and some other things. Then you will place it in your kidney basin. The placenta is out, and now we are going to check the perineum for any tear, any lacerations and other things. And when there is none, we are going to wash the perineum or flush it out. So we are going to check. Okay, just a little laceration. So we are going to, I have this, so we are going to clean the perineum and flush it with water. Okay. After cleaning the perineum, we're now going to apply pad or cloth, yeah, to the perineum. The woman is going to put on pad. Now we're done with the delivery of the placenta, and I've discarded the placenta in a plastic bag, and I've also decontaminated the instruments. I'll wash them later. So now let's attend to the mother and the baby. Hello, poor mom. How are you feeling, poor? Okay, are you okay? Okay, everything shall be fine. Mom, please maintain skin-to-skin contact with the baby. Let the baby's chest face your chest with the head turned on the side. Yeah, that is called prone position. Like the baby's chest will be facing yours, and the head will be turned to the one side. That's where the baby can breathe. Okay, so I encourage you and I urge you to maintain this skin-to-skin contact, because it will help the baby. It will avoid the baby from getting infection or hypoglycemia or any other newborn diseases. Thank you. Hello po ma'am, kamusta po? So ma'am, please, I'll advise you to observe the feeding cues of the baby, and some of these feeding cues are the routine reflex. So for the routine reflex, you will see that the baby will be in search of the nipple to suck breast. Yes, the baby will be turning head, trying to locate where to feed, and also crying could also be a cue. So those are it, and sometimes they will be doing their tongue like that. Yeah, all those things are cues that you should observe for. So ma'am, I'm going to assist you to give a full breastfeed. It's very important. The first breast milk, which is called colostrum, is very, very important. It's full of nutrients, and it's going to serve as antibodies, which is going to help the baby fight infection. So it's very, very important. So I will assist you to lie comfortably. You can actually lie on the side position while the baby will be lying on your left hand. Okay. Okay, so let's put the baby here. Okay, you can also turn your side. Good. Okay. So I will help you. Okay, so this is the nipple. Let's give. Anytime you're giving breast milk to the baby, make sure that the nipple doesn't cover the nose of the baby. If not, the baby will have difficulty in breathing, and that can cause the stress. Okay. So you can use this hand to hold the baby's side to support him. Okay. So I'll wait for you to finish breastfeeding him, so I can give him the vaccine, which is the vitamin K, the BCG, and the hepatitis B. Okay. So now I've detached the baby from the woman because he is fully breastfed. So now I'm going to check the physical examination, which are the head circumference, the chest, the weight, the heart rate, and the RR. So with the head, you just put the tape measure above the eyebrows to the occiput. So I'm going to do that to the baby. Yeah, you put it on the eyebrows round to the occiput. Okay, so it measures 34 centimeters, and the normal range is between 34 centimeters to 35 centimeters for newborns. So this one falls under normal. So the second one, I'm going to check for the chest, and that one you have to put it on the nipple, like that line to the back. It should be straight, it should not be curved. Okay, so I'm going to put it under him, and I will measure. Okay, so this one also weighs 33 centimeters, and the normal should fall between 32 centimeters to 33 centimeters. So after that, and I already checked the weight. The weight is 3 kilograms, which is normal, because the normal is between 2.5 to 3.5 kg according to our MS book. Yeah. So I'm going to check the temperature, and this one we're just going to check it through the axillary. So I'm going to put the thermometer in the anus to check for the temperature. Okay, so I'm done checking it, and the temperature is 97.7 Fahrenheit. Yeah, the normal should be between 97 to 98 Fahrenheit. So about the heart rate, we're going to use our stethoscope. Excuse me, I don't have stethoscope. We're going to use our stethoscope, and we will put the bell on the left side of the baby. We're going to check it for a complete 1 minute. We're going to count it. Okay, so the heart rate is 120 beats per minute, and the normal should be between 120 to 140. So this one too is normal. So we're now going to count for the RR, the respiration, for 1 full minute. So we are just going to observe the baby chest, how it rises and falls. So we're going to count. Okay, and this one is also 40. It's normal, because the normal falls between 30 to 60. So we're done with this. So now we're going to give the vaccine. So the vaccine, we have our eye ointment. Let's assume this is our eye ointment. We have our hepatitis B vaccine, vitamin K, and our BCG. Like I explained earlier, the BCG is to prevent tuberculosis. The hepatitis B is also to prevent hepatitis B, and also the vitamin K is just to prevent the vitamin K deficiency, which causes bleeding. So we have our syringe, our 3 different kinds of syringe. So for the vitamin K, we're just going to give a dose of 0.1 milliliters in the right thigh, and for the hepatitis B, we're just going to give 0.5 milliliters in the left thigh, and for the BCG too, we're going to give 0.05 milliliters in the right arm. For the vitamin K, it's going to be intradermal. It's going to be intradermal, and for the BCG and hepatitis B, it's going to be intramuscular. So assuming this is the BCG, so you hold the baby's leg firmly, because you know newborns love to shake. So you hold the thigh firmly like this, then you put it, since it is IM, you point it straight, then you hub like this, then you aspirate, there is no blood, then you inject it inside. Yeah, then you discard your needle without having it. So that is what we're going to do for the BCG and the hepatitis B on the different on the other thigh. And for the vitamin K, since it is intradermal, we won't put the needle in 90 degrees. It's just going to be like 45 degrees, something like this. Yeah, then we aspirate and we inject. So that is it for the vaccination. But before that, we forgot the ointment, the eye ointment. That is the first thing I should have done. We first give the eye ointment, and that one we give it from the inner to the outer. So assuming this is the baby, you open the eye, you put it in from the inner to the outside for both eyes before you give all the injection. That is the number 1 thing you should do. So after the injection and everything, I will deliver the baby to the mother, and I will advise the mother to breastfeed the baby upon demand. How will she know? Because I already gave the feeding cues where the baby's head will be moving to locate the nipple, and when the baby will be, that is the routine reflex and they're crying and the other. So, and I will also advise the woman to shower the baby. Like, it's optional, it's not compulsory to do it in this early life. Like, she can do it at the appropriate time. And yeah, that's it. And also I will keep checking the baby's vital signs and the woman too every 30 minutes. And I'm going to, every 15 minutes I'll be massaging the woman's uterus, and I'm going to record like, I'm going to do all the documentation, the dosage I gave, everything, the response of the woman, the baby, everything. I'm going to record them so that I can put in the patient's charts. Thank you for watching this video.